In this video, I'll be showing you nasal oxygen care for my patient. I've already put a little bit of lotion on the end of his nasal cannula cord. That way we can get the real feel for if it was any kind of mucus. Okay, we're going to go ahead and get started. Hello, Mr. Landon. How are we doing today? Good, good. My name is Kristen Calhoun. I'm a CNA student from PG Community College, and I'm here today to wipe your face, to wash your face, and also I'm going to clean your nasal cannula cord. Is that okay for you? Good. At this time, I'm going to pull the privacy curtain. I'm also going to let him know to give me a couple of minutes so I can get my utensils. Okay, Mr. Landon, give me a couple of minutes so I can get my utensils, and then we're going to get started, okay? Okay. Pull the privacy curtain. I'm going to wash my hands. I already have my utensils pre-set, so I'm just going to go over them with you real quick. I have a basin bowl with water, and I'll let Mr. Landon check to make sure that's a good temperature for him. I have 2 washcloths. One's for the face and one's going to be for the nasal. A privacy towel, which is also going to be used to dry off his face. And then I have some towels here, and that's just to clean out the basin bowl after I've rinsed it. And now I'm going to finish with my patient. Okay, I'm washing my hands. Okay, Mr. Landon, we're going to go ahead and get you started, okay? I'm going to lower, and I'm going to raise your bed so that it's a little easier for me to get to you. All right. I'm going to grab our towel here, and I'm going to place this right over top of you. Okay. Next, I'm going to go ahead and grab my gloves. Okay, Mr. Landon, can you test this water for me? Let me know if it's too hot or cold. Just let me know how you feel. How's that feel? Good? Okay, good. And here we go. We can wipe off your hand with your towel. Good. Cover you back up. Okay, now we're going to go ahead and get started, okay? I'm going to pull this back. Do not worry, I'll be quick. First washcloth into the water, rinse out. I'm going to make sure I fold it into a triangle. That way it gives me 1, 2, 3, 4, and 5. Okay, Mr. Landon, I'm going to start to wipe your face now. I'm going to start with the eyes, wiping from the eye to the ear. Then I'm going to wipe down his face, down and around, down and around. Lastly, I'll get his nose. There we go. I'll let this go in the soiled linens. I'm going to grab another washcloth, damp it, rinse it out. And now I'm going to clean his nasal cannula cord. That's going to be in the dirty linens. And I'm just going to bring it to the screen so you can see it is clean. One last thing before I put his nasal cannula cord back on, I'm going to grab his old gauze that he had on his ear, throw that in the trash. I have new gauze right here. I'm going to fold that right on the back of his ear. Do the same thing with one more gauze on the other side. This is to prevent any pressure sores from having this cord around his face. At this time, I'm going to go ahead and put the cord back on. Back in the right place. There we go. Another thing too, if your patient complains of it being too tight right here around their face, another thing you can do is you can take some more gauze here and place it just like that to prevent a pressure sore from on their face as well. Okay? So I'm just going to take that off because Mr. Landon is okay. All right, Mr. Landon, we're all finished, okay? Now I'm going to get the rest of your linens up, okay? Okay. So that's a soiled linen. We've patted his face dry. He's good to go. So we're going to throw that in there. I'm going to take off my gloves. Throw those away. I'm going to go ahead and wash my hands real quick. And then I'm going to go ahead and rinse out my basin bowl. Have my water right here. And this is going to be my bedside commode. I'm going to pour the water. Get some more. Pour the water. Paper towel. Rinse it out. Throw that in the trash. Put this over here. On soiled utensils. Okay, Mr. Landon, I'm going to wash my hands one more time and then I'm going to lower your bed, okay? Wash my hands. Because I just touched the basin bowl. I just want to be sure. Okay, Mr. Landon, we're all done for the day, okay? I'm going to take your call button here. I'm going to lower him back down to the lowest level. Okay, Mr. Landon, here you go. You let me know if you need anything else, okay? Okay.